The biomedical waste management rules were notified under the provisions of Environment Protection Act in the year 1998. These rules lay down the regulatory framework for environmentally sound management of biomedical waste. Over the years, compliance with the provisions of the rules has improved significantly. However, there is still a long way to go. Keeping this in view, the film that you are about to see has been made to bring forth the essential features of environmentally sound management of biomedical wastes. I am hopeful that all those concerned with biomedical waste management would find this film useful.
Precaution is better than cure, as a frequently mouthed quote affirms life, emphasizing on the importance of the absolute inevitability of maintaining a clear and an infection-free environment for life to bloom to its potential. As a complex multidisciplinary structure, a hospital consumes a lot of resources for appropriate delivery of medical care. The leftovers from the consumable are termed as hospital wastes.
It has some proportion of the waste which is infectious, and it is only 10 to 15% of the waste which is infectious, and we have to take care of that waste. Other waste, which is near about 80%, or you say it's the general garbage, that is taken care by the municipality. Municipality people, they take it in their vehicles and they take care of that. We have to take care of only 15% of the waste. And if we don't take care of that 15% waste, it becomes 100% infectious. Then it becomes entirely responsibility of the hospital to take care of that waste.
Hospital wastes, which is a residual result of patient care handling activities, namely diagnosis, immunization and research, can pose a potential danger to the environment as a storehouse of viral, bacterial or parasitic diseases.
General waste is never infectious when the waste is fresh. It gets infectious only when it putrefies, while as hospital waste is most infectious when it is fresh. So chances of spreading disease is immediate threat. And the hospital should always think that they should be the center where the diseases are diagnosed, treated and cured. They should not be the agents which are knowingly or unknowingly contributing in the spreading of the diseases.
The people in the hospital as well as the people who handle the biomedical waste, they are likely to get infected. I can quote you an instance that before implementation of the system, whosoever was put on the garbage dumping site, Safai Karamchari who used to work on the garbage dumping site, used to get very serious type of infections. 4 of our Safai Karamcharis got tuberculosis, which was a very resistant type of tuberculosis, and one of them unfortunately died also.
The health hazards of poor waste management practices are injuries from sharps to all categories of hospital personnel and waste handlers, hospital-acquired infection in patients from poor waste management practices, risks posed to the health of hospital staff due to poor management of biomedical waste generated from patients suffering from communicable diseases, dangers associated with the hazardous chemicals and drugs being handled by staff personnel, disposables being recycled and sold by unscrupulous elements and thus posing a threat to life, health hazards to the community. As a result of years of negligence to this vital aspect of waste management, Government of India stipulated the Biomedical Waste Management Enhancement in July 1998 to regulate the disposal of biomedical wastes. The prime objective stipulated was the safe disposal of these wastes to prevent adverse effects on the environment. Any violation of these rules, which apply to all persons who generate, collect, receive, store, transport, treat and dispose waste, would lead to punishment as per the Environment Protection Act 1986. An imprisonment for a term of up to 5 years or with a fine extending to 1 lakh rupees can be a result of non-conformation with the rules. The rules are comprehensive and cover almost all aspects of biomedical waste management, such as authorization, generation, segregation, packaging, transportation, storage, treatment and disposal of biomedical waste. Schedule 6 of Biomedical Waste Rules 1998 instructed all hospitals, nursing homes and institutions generating biomedical wastes to provide facilities like incinerator, autoclave, microwave system from 31st December 2002. An urgent need for the awareness of health personnel, namely the head of the institute, departmental heads, doctors, nurses, paramedical staff and Class 4 staff realize their vulnerability to the potential dangers of the wastes generated in their own work areas and become socially conscious.
We as medical practitioners are paying a very heavy price for our negligence in this important field of waste management. And we have tried to create awareness in the city of Mumbai, not only in my own institution, but throughout the healthcare institutions, spreading this message even up to the nursing homes. We as generators are responsible for the treatment to final disposal of the infectious waste that we generate.
A detailed overview of the scientific techniques involved, from the generation and segregation of hospital wastes to storage, treatment and disposal, will allow us to understand the potential danger and the necessary steps to be taken to eradicate it. Hospital waste can be classified as general waste and biomedical waste. General waste is engendered from administration areas, stores, kitchen and housekeeping. General waste should be segregated and disposed as per the Municipal Solid Waste Rules 2000.
Many hospitals generate lots of this biomedical waste, which may be in the form of leftovers of blood, urine or other body fluids which have been taken for testing, or it may be dressings and bandages which are soaked with patient's blood, patient's body fluids, or it may be body parts that are removed during surgery, or it may be other things which come in contact with patient's blood like needles, syringes and sharps, and all these things can harm somebody who is unarmed, who is unprepared, and if he comes in contact with these fluids.
These wastes are classified as Category Number 1, human anatomical waste that consists of mainly tissues, organs removed during surgery and placenta. Category Number 2, animal wastes, waste generated from an animal house. Category Number 3, microbiology and biotechnology waste like cultures, stocks and samples. Category Number 4, sharp waste, which includes hypodermic needles, needles attached to tubing, broken glass pieces and scalpel blades. Category Number 5, discarded medicines and cytotoxic waste that comprises of various anti-cancerous drugs used for treating malignant conditions. Category Number 6, soiled waste like soiled dressings and other material contaminated with blood. Category Number 7, solid wastes, which is the waste generated from disposable items. Category Number 8, liquid wastes, which consist of waste generated from laboratory and washing, cleaning, housekeeping and disinfectant activities. Category Number 9, ash, from incineration of any biomedical waste. Category number 10. Chemical waste are solutions such as formaldehyde used for preserving tissues, fixer and developer used in radiology department, and the chemicals used in disinfection. Apart from these 10 categories, mercury is also generated as waste.
The mercury is involved in hospitals. It is as a fluid in the thermometers and the sphygmomanometers, both of which and other instruments also. It is basically it affects the central nervous system. There is no routine kind of emissions in the hospitals. Basically, they are accidental spillages or releases in view of the breakage of thermometers or during maintenance of the sphygmomanometers, which are blood pressure measuring instruments. So, what I would like to suggest that the hospitals first try to eliminate, in the sense that they try to go from mercury based thermometers or sphygmomanometers to non-mercury based. We have now digital thermometers. After the accounting system, there should be a ready accessibility and availability of a simple kit, which we usually call a mercury spill kit. That kit is a very simple, it can be made locally in the hospitals also.
Our hospital waste used to go to the garbage dumping site. The rag pickers used to, isolate the disposable items, and they used to take it for recycling. That was very bad, very, hazardous for the society. Once the recycled items they can cause any infection to the society, which includes infections like hepatitis and AIDS. So, with the implementation of the segregation practices in the hospital, those things have been stopped.
Wastes are segregated as infectious and non-infectious, minimizing risks to staff and public, which are undertaken by sorting. It is the most important prerequisite and the key to the entire process of waste management, allowing special attention to be given to the relatively small quantities of biomedical wastes. Biomedical and general waste should be placed in color-coded plastic bags and containers. This would enable the Safai Karamchari to take the bags to their respective areas of treatment technique. Segregation in accordance with the biomedical waste rules and available treatment facilities is advisable. Treatment practices should emphasize more on non-burn technology. The colors accorded to the containers and the bags inside the containers should be matched for easier management. Let us briefly look at the procedure for segregation of color-coded bags. The black container and bag should contain discarded medicine and cytotoxic drugs, chemical waste, and incinerator ash. A non-PVC yellow bag should be maintained to collect human anatomical wastes like placenta, soiled waste, animal waste, and microbiology and biotechnology waste. A red container and bag should be allotted for microbiology and biotechnology waste, soiled waste like items contaminated with blood, body fluids including cotton, dressings and soiled plaster, solid waste such as tubing, catheters, IV tubes. Blue or white container and bag should comprise of only sharps and solid wastes such as tubing, catheters and IV tubes. Containers should be placed close to the site of generation of wastes like nursing station and other convenient locations in the ward, especially in the more vulnerable units like ICU and OT. Proper covering with lids and labeling with symbols of biohazard and cytotoxic should be provided on transport of biomedical waste containers and bags in order to refrain from mishaps. Puncture-proof bags are necessary for this procedure. The bag should further be sealed after 2/3 of the bag is full with ties and labeling it at the source of generation. The sealed bags should be held only from the neck and should be ensured that bags don't tear apart. Bags and containers should not be removed unless they are properly tied, secured and labelled. The hospital attendants or Safai Karamcharis should collect the waste containers and ensure the replacement of fresh containers and bags on time. After the segregation, storage of the hazardous and infectious wastes become vitally important till the time proper treatment can be meted out to them. Storage in the container should not prolong for more than 48 hours and should be cleared once a day.
We have made a room which has got a roof, which has got a door, mesh is on the window and it is on lock and key. We have raised a platform of about 2 feet and all, and we have lined it with vitrified ceramic tiles.
After the collection, waste is then transported to the treatment site. Transfer routes must be designated in a way to avoid the passage of waste through patient care areas, and suitable time should be allocated. A well-structured program is required to minimize and eradicate the danger posed by biomedical waste, and transport constitutes an important step. Transport becomes an activity where utmost care and precautions are to be maintained. When transportation of wastes is within the hospital, it is known as intramural transportation. The colored intramural vehicles are pushcart, garbage trolley, wheelbarrow. Well-organized vehicles of transport with respective color-coded specifications are requisite for proper management. The vehicles should be covered, leak-proof, thoroughly cleaned and disinfected after every use. Waste is transferred from departments, wards to a garbage collection point before going for final treatment. When the wastes are transported outside the hospital, it is known as extramural transportation, garbage van, lorry. Prior to the final disposal is the treatment of hospital wastes by transforming the waste into non-hazardous residues to avoid human exposure and its dispersion into the environment. Treatment is necessary for complete eradication of microorganisms and refrain further use of the waste for safety. Various procedures employed for treatment and disposal include incineration or deep burial in places having a population of less than 5 lakh and remote rural areas, microwaving, autoclaving, hydroclaving, shredding, chemical disinfection, yellow bag assigned for human anatomical wastes, wastes from OT, laboratory, animal wastes, microbiological and biotechnological wastes is subjected to incineration or deep burial. Red bag, which constitutes soiled wastes, solid wastes and microbiology and biotechnology waste is subjected to microwaving, autoclaving, hydroclaving. Chemical treatment can also be imparted if the quantity of waste is very small. Blue or white bag containing sharps and solid wastes is subjected to autoclaving, microwaving, hydroclaving and followed by shredding. Black bags assigned for discarded medicines and cytotoxic drugs, incinerator ash and chemical wastes are disposed in a secured landfill. Incineration reduces organic and combustible waste into inorganic ashes. Through reduction of waste, volume and weight, the incinerator ensures complete combustion of waste.
Biggest advantage of using incineration is the volume reduction up to 90 to 95%, and then you get better destruction of the biomedical waste as compared to the autoclave, microwave or hydroclave. Also, a good amount of energy can be recovered through the incineration process by using the heat recovery system.
The temperature in the primary chamber is around 800 degrees Celsius, while in the secondary chamber it is 1050 degrees Celsius. The smoke emitted passes through a scrubber and then a chimney whose minimum height should be 30 meters from the ground. The remaining residue in the form of ash is disposed of in a secured landfill. The categories of wastes that can be incinerated are human anatomical waste, soiled waste, animal waste, microbiology and biotechnological waste from laboratories and research institutions. No chemical pre-treatment should be done before incineration, and chlorinated plastics are prohibited in the incinerator due to emissions of dioxin and furans.
Incineration, since it has got the complex phenomenon behind the incineration process, so one has to be very careful while selection of the incinerator. I mean, a poorly designed incinerator can lead to the emission of the pollutants, as well as inefficient air pollution control devices, which is also very much required to comply with the regulations of the biomedical waste. So these two are the key aspects, like design aspect and the air pollution control. And third is the skilled operation. These incinerators should be operated by a trained person having the know-how of the incineration process.
Deep burial can be employed as a disposal method in rural areas having a population of less than 5 lakh and should have a suitable land. The burial site should be away from the patient care areas and water resources. In a 2-meter deep site, wastes are mixed with 10 centimeter of soil and lime in layers. When the contents reach up to 50 centimeters of the surface, the pit is filled in with lime and then soil. The area is then surrounded with a wire mesh to prevent the entry of animals. The method is suitable for disposing of wastes like human anatomical wastes and animal wastes. Deep burial may not be an option at coastal areas where the water table is high. Microwaving induces a low-heat thermal process inside the waste material. Microwaves and electromagnetic waves which enter the waste lead to vibration of molecules, producing friction and finally resulting in disinfection due to heat produced.
Microwave is comparatively new technology. It is used to disinfect those categories of waste, especially which we cannot incinerate, like plastic waste, glass waste, because as we know that polyvinyl chloride, PVC, cannot be incinerated as it generates very toxic gases. So this is an alternative to these technology. After disinfection in microwave, these can be shredded and can be recycled.
Microwave treatment should not be used for cytotoxic, hazardous or radioactive wastes, contaminated carcasses, body parts and large metal items. Autoclaving is a low-heat thermal process which uses high pressure to bring steam into direct contact with the waste in a controlled manner for sufficient duration to disinfect the waste. The process has now been employed for a long time for sterilization of reusable medical instruments, microbiological cultures and STOX solutions. It is an effective method for treating biomedical waste like microbiological and biotechnological wastes, sharps, soiled waste and solid wastes. A separate autoclave dedicated for waste treatment can be an effective solution. Two types of autoclave are well recognized: a dry system where steam is run through the jacket and a wet system where steam is introduced into the chamber itself. Low capital and operating costs, low level of skills required for the operators, minimal liquid effluents and non-hazardous air emissions makes it a very economical treatment of wastes. Hydroclave, a dry heat system, is an improvisation of an autoclave. It works like an autoclave, but with a rotor inside that partially shreds the waste, thus increasing the surface area for the heat to act upon in a better manner.
Autoclaving or steam sterilization is an absolute term. That means you sterilize whatever you're putting in it. When I say this, I mean we get a log 6 reduction in the microbial burden or the bio burden. That means if there are 10 raised to 6 microorganisms, all 10 raised to 6 are destroyed by this particular methodology. So this is the level of sterilization that we are reaching with waste as well. The other advantages of this system are that in this system, the waste is being mixed, and mixing of the waste actually takes care of the cold spots which we find in a traditional autoclave. The waste is mixed, there are no cold spots, ensuring sterility of each and every inch or each and every bit of waste that is actually being sterilized. The other major advantage we evaluated in this technology was that we get a nearly 80% reduction in the weight as well as the volume. That means the waste that comes out is totally dry, and it is almost not recognizable or definitely cannot be used as a medical item.
It is an effective method employed in treating biomedical waste like microbiological and biotechnological wastes, sharps, soiled waste and solid wastes. Shredding. Plastic wastes such as catheters and IV tubes that are treated through autoclaving, microwaving or hydroclaving are subjected to grinding and shredding. Shredders cut the waste into small pieces, reducing the volume and render the waste unrecognizable.
There are few problems associated with the shredder also. The prime problem with that is of choking problem. If you have a plastic of different material, so one plastic which has got lower strength, that might choke or jam the shredding, the shaft of the shredder. So it should be properly designed to take into account of all the plastics having different plastic strength. And secondly, the important aspect also is about the noise. So it should not generate a lot of noise also during its operation.
Shredding consequently prevents illegal packaging and reuse. The waste can then be recycled. Chemical disinfection. Plastic wastes such as gloves and tubings are cut and mutilated before disposing them in a disinfectant which constitutes 1% hypochlorite solution for a minimum of 30 minutes in a sharp decontaminating unit. The empty glass vials, ampoules and bottles are broken to prevent reuse, and the lotion is freshly prepared. For sharps and plastic disposable, a needle destroying machine can be used. Chemical disinfection is cost effective and does not require large investments. A chemical is used to destroy the pathogens. In this process, the most commonly used disinfectant being 1% bleaching solution. Immediately after usage, the syringe and the needle should be filled with the disinfectant and transferred later to the blue container. This method should be used in very small healthcare facilities, as it may not be effective if quantum of biomedical waste becomes large. Common treatment biomedical waste treatment facility is a setup where biomedical waste generated from a number of healthcare units is imparted necessary treatment to reduce adverse effects that the waste may pose. The person responsible for collection of biomedical wastes is required to carry a register to maintain records. Utmost care has to be maintained in transportation of biomedical waste to the common treatment without any damage, spillage or unauthorized public access. Vehicles must be dedicated and labelled with prominent symbols of cytotoxic and biohazard symbols. It should be ensured that the vehicles are covered with interiors of stainless steel and the corners rounded off to facilitate easy washing.
We have prepared a detailed guideline given in our website and circulated to all the state pollution control board and agencies. And this common facility is consisting of various type of technologies like autoclave, hydroclave, and an incinerator. We have given a very detailed guidelines and standard for the incinerator, which consists of pollution control equipment also, air pollution control equipment also. So far we have 85 as on date biomedical waste facilities.
A common treatment plant should be situated in an area reasonably away from residential accommodation in a minimum area of 1 acre land in order to avail its proper functioning and maintenance. It is necessary for the common treatment plant to provide all requisite systems including incinerator, vehicle container, washing facility and water treatment plant. The infrastructural space of a common treatment plant requires sufficient space to install required treatment equipment. Treated waste storage room and administrative room where record keeping and billing is carried out. Maintenance of records in the common treatment regarding the quantities of waste accepted and treated is paramount.
In Ludhiana also we thought of segregating biomedical waste from rest of the waste for treating it in a safe manner. Otherwise also there is mandate of the Supreme Court to dispose of biomedical waste in a safe form. So we thought of creating a common facility for whole of Punjab to begin with.
Common treatment plant is an ongoing process that incessantly works towards a provision of an economical alternative biomedical waste management. An effective waste management committee needs to be constituted, headed by the hospital head and managing heads of various departments, including a nursing superintendent.
The composition of the Hospital Infection Control Committee consists of a chairperson who presently at our hospital is the director, Dr. K. Dinshaw, the co-chairperson who is the medical superintendent in my institution. I am the secretary, and then we have members from all the departments. So this committee is responsible for laying down the policies and implementation of these policies for the prevention and control of all healthcare associated infections. So waste management is just one of the components of the functions of or the objectives of the Hospital Infection Control Committee.
Their responsibility also entails a proper record keeping of the daily and annual wastes generated and discarded in the hospital. Ensuring safety and training of various categories of hospital personnel also constitutes an important task of the committee. This team can initiate IEC activities for awareness generation through various mediums such as training films, posters and street plays. The committee's endeavour in carrying out organised waste management is primarily headed by the medical superintendent.
So the superintendent of any hospital must check out that this project cannot be successful without his dynamic and continuous participation, because he is the liaison between the funding agencies and the hospital, and he has to ensure that requisite professional inputs are put so that this science is continuously upgraded, and also the continuous maintenance of this management system.
Other members with the superintendent also undertake awareness activities.
We are using so many disposable items. So if we don't dispose them properly, they come into market again. So they are recycled. So it's a responsibility of all the users, of all the medical profession, that these are disposed properly so they don't come into the market again, because we know the hazards of reusing of needles and syringes.
Coordination and welfare of manpower is also an important task of the committee.
My responsibility is the collection of the waste. Every 6 months we have to health checkup and immunizations.
Smooth operation through technical support further unifies the organizing body.
Our responsibility is that to check the time to time pressure, temperature. Our management immunized all our technical and labor staff there, and they are giving all protective gears to our staff, like shoes, overcoats, gloves, masks.
There is a need to change the mindset and the attitude of the people working in the hospitals regarding the hospital waste management.
The 100% biomedical waste generated, which is generated in the country, should be properly segregated, treated and disposed.
Hospital managements feel reluctant to make any investment to this important avenue because there is no apparent return on investment. But in the long run, if we overview the things, then it turns out that ultimately we gain by checking infections, by smooth flow of the patients.
This is an appeal to all my fellow colleagues from the healthcare profession that one should never give up in frustration. Take one step at a time, and finally you will have one of the best systems in the world that we can achieve. Money is not the only issue, technology is not the only issue. Start somewhere.
Mother Earth's soul is a treasure to nurture, not to choke its existence. It is this elixir of life we need to water and nurture for a clean environment to be inherited by our children. As Gandhiji said, be the change you want to see in the world. The journey to change our future begins with us.